Well, good morning. I want to thank you all for being here. This is a fun event. This is the third time we've been able to host this event here. I want to thank you for what you do in the community and the support you give this organization. My name is Brandon Nutt. I'm blessed to be the Chief Operating Officer here at Gordon Hospital and at Murray Medical Center. First, I want to apologize. Pete Webb, our CEO, at the last minute had to change his plans and is unable to be here. And so the rest of the morning, I want to talk, or at least for the few minutes I'm up here, talk to you a little bit about the organization, where we've been over the past few years, and some of our goals for the future. We have been blessed to have a mission of extending the healing ministry of Christ, and it's something I'm quite proud of, but at the same time, it's humbling to know that that's our calling. We are so committed to making sure that our quality is where it should be. Our experience is one that would honor our mission, and it's something that we don't get right every time, but at the same time, we're trying to make sure that those things like the awards that we've been able to receive, being best hospitals in the state and top 100 hospital and the different initiatives like that, they're important to us because we think that's a reflection of our mission. Our vision and what we've been working on over the past few years started with our board. We get together like most nonprofit organizations, and we have a board made up of community leaders, some in this room. We have physicians on that board. And they asked us to really, over the next few years, work on 4 initiatives. And we've been doing that. Specifically, I'll go with number 1. They wanted us to be very intentional about partnering with local businesses, with groups, church groups, civic groups. We want to make sure that that is something that you view as a value. We want to make sure that we're at the table when you're talking about healthcare needs for your organizations. We want to make sure that we're taking advantage of opportunities where Tracy Faribault can get involved and do health promotion activities. It's important for us to have those conversations. We want to be viewed as a partner, and at the same time, we know sometimes decisions come down to dollars. Sometimes benefit administrators and health insurance companies get involved, but we want to feel as a partner, and we appreciate the support that we've had so far. The second initiative that we've been working on is our physician network. Most of you know 5-6 years ago that we employed probably 10 physicians. Today, we employ over 100 providers. That strategy is very, very important to us. And primarily because we view the continuum of care to be so critical to taking care of communities. We realize that people come into the hospital when they're sick, and we want to make sure we get them out as quickly as possible. But if you don't have that entire continuum of care to support it, then people oftentimes will come right back into the hospital. We have excellent home care services, PT services, but the physicians have to coordinate that. And it's important to have that relationship and strong for everyone. Number 3, we've been working on a relationship with Murray Medical Center. Most of you know that that hospital was close to closing several years ago, and with the help of our corporate office, Adventist Health System, we were able to step in and turn that around. The hospital had been run by the county and an organization just north of here prior to that, and it's really neat to see how finances have turned around, and that organization hopefully will start to thrive as a result of our relationship. And so how does that impact the folks here in Gordon County? Well, when you have 2 organizations taking care of larger populations, we're able to recruit new physicians. You've got the roughly 60,000 people that live in Gordon County, 40,000 that live in Murray County, and we're able to recruit physicians. This fall, starting in November, we're going to have our first cardiologist that's going to be here full-time, Dr. Scott Westermeyer. And so folks will no longer have to go out of town for cardiology services. We just hired Dr. Brad Goff, who's here down on the ground floor, a full-time ear, nose, and throat physician. He started this month, and that's a fantastic service that we in the past hadn't had full-time service. There's other physicians just like that we're able to recruit and provide for this community as a result of taking care of larger populations. The next piece I want to add is the services that they asked us to work on. And we have fantastic physicians, and we could focus on a lot of strengths and so forth. But the two they wanted us to work on, number one was cancer care. And when you look at North Georgia, we've said this in the past, but we have the best cancer team in North Georgia without a doubt. It starts with Dr. Eric Turner as the medical oncologist and the infusion center. We have the Harris Radiation Center right across the street. That was an excellent addition to the community several years ago with Dr. Lori Hughes leading that cause. Dr. Craig Box, who is fellowship-trained surgical oncologist, the only one in North Georgia. We have Dr. Hawk Lee, who came here 2 years ago, who's a fellowship-trained urological oncologist, the only one in North Georgia, and also has a fellowship training in robotics. And when he came, we were able to purchase a robot, and it's fantastic, the services that we're able to provide in this community as a result of that technology. In the past, we had to transfer patients outside the community to do these complex cancer cases, and we're able to do them here in Gordon County now. We also have a fantastic support team with pathology group and a great radiology department. Specifically, we have Dr. Courtney Perez, who is a fellowship-trained radiologist in breast health. And so that group really is something that is significant. I've been in tumor board meetings. I see them talk about specific cases and how they're working and collaborating together. And I just want you to know that you should have the most confidence in the world that this team is going to take care of your cancer needs. It's fantastic, and you're going to hear more about some of the stuff we're doing with cancer care. Last, we wanted to focus on women's health. Our board asked us to focus on that primarily because women are the ones that are making decisions in our family. And most of you know that. It's very clear that the wives, the moms, they're making the decisions, and we want to be more intentional about partnering with them. That's through their primary care offices. That's through their OBGYN. We've gone through the process of consolidating services. We feel that's going to help as we combine the talent within our community. We did that with Dr. Morgan and Taylor and Dr. Wadake, and then we hired Dr. Dyer, who came up here from Wellstar, who's also robotics trained. And so we're going to continue to focus on women's services, and so that's kind of the areas that we've been working on over the past few years. 2 years ago we got together here, and we had a grand opening for the new ER, ICU, and PCU rooms. It was a $37 million project, and we're so grateful that our community has supported those causes. And it's neat being part of a nonprofit organization that's able to give back so much to the community. Over the past 5 years, through free health care, through wellness initiatives, chaplaincy, spiritual care, and investments into this building and capital improvements and technology, we've invested over $150 million back in the community. And that's a lot different than some of the for-profit hospital systems where they have to take care of their shareholders and make sure the profit goes to folks outside of this community. So we're, through the success we've had with recruiting physicians and focusing on these service lines, we feel it's time to start a new construction project. And so we're going through the planning process of that right now. We'd like to start working on expanding our operating room. We recruit a lot of surgeons and focus on cancer. You've got more complex cases. Growing our orthopedics programs and stuff like that, we're needing probably 2 more operating rooms. We're also, with the addition of a cardiologist, we're going to need a new cath lab. Our interventional cardiologists are using that, our interventional radiologists are using that. We've had some cardiology support in the past, but we're going to need to add that technology to take care of our community. The next 2 areas that we want to focus in are specifically geared to the 2 service lines that the board has asked us to work on. Women's health, is around the Baby Place. Most of you know the Baby Place is located on the opposite side of the hospital, and frankly, it's a little dated, and we need to update that. We need to modernize that, and we'd like to move that over to this side of the campus, and get the support to make sure that that happens for the new moms as they bring new life into Calhoun. And the last thing we want to focus in on is a women's imaging center. You may see some of the renderings in the room, and we're going to talk a little bit more about that this morning, but it's something that we really want to build, and we're still going through the planning process. We want to continue to get more support through this initiative, but in Gordon County, less than 50% of the women take the preventative step to get their mammogram, less than 50%. And 1 in 8 women are going to get breast cancer. And so it's important that we do everything we can to have a facility, a process that encourages women to come in, and we need to take care of them in a better way. And so we're looking at having the Women's Imaging Center located right over there, which is where our old ER was, and I'm talking about 10 plus years ago where our ER was. It'll be a spa-like environment, easy outpatient entrance. You're not going to have to register multiple times like the current process is because you have to wind in and out of the hospital. We're going to have the latest technology with 3D mammography. And so we're really excited about that, and we're grateful that we've been getting the support to be able to build that. But we want to continue to talk about that in the community, specifically those two initiatives, focused on women and focused on cancer. Thank you so much for coming here. I want to say thank you for everything you do for the community and supporting this organization. We're a better place because of the work you do in our community and the partnerships we have. We feel that if we're able to take care of our community in a significant way, we're going to have vibrant Calhoun, vibrant organizations, businesses, and so forth. And so thank you so much. I'm going to turn over to Karen Seeley, who is our one of our vice presidents here at Gordon Hospital and also the administrator at Murray Medical Center.
Well, good morning. So I'm going to have a disclaimer straight out of the gate that I'm not a professional speaker. So bear with me as I talk to you a little bit about this morning about women's health. As you can see, and I'm hoping the picture is here for you, this is my family. And my family looks like many of your families. In my family, we have 3 generations of very strong, very opinionated women. Seriously, just ask my husband. And with that, I would say that many of you have 4 or maybe 5 generations of women in your family. The 3 women in this picture remind me of why women's health is so critical. Of the 3 women in the picture, taking care of myself is by far my greatest challenge and my biggest opportunity. Because like most women, I represent the cornerstone of my family's overall health, and they rely on me. And like most of you in this room, I'm a busy mom, a devoted wife, a loving daughter, and a hardworking businesswoman. In addition to those roles that we carry, somehow we find time to volunteer at our churches, our schools, our children's activities, and probably other organizations that you work with. And at this point in my life, I am more than just my mother's daughter. I'm her person. I'm her chauffeur when she needs that. I'm her advisor. I'm her support system. And sometimes I'm her locksmith at 8 o'clock at night when she locks herself out of the garage after she's walked her dog. But honestly, I'm whatever she needs me to be. Also, when you look at my daughter, I'm her mentor. I'm the picture of what women's health should look like. I'm her role model. So yes, women's health is very important. Maybe it's because I've been a nurse for almost 20 years, and that sounds like a really long time when I say that out loud. But as a nurse, I've had a front row seat in seeing how easily and quickly health can change. I am proud that I can be confident in our services and that I and my family can choose to stay close to home. You know, I love the chatter when we see new restaurants and new shops come into town. It's exciting to see our schools expanding and offering opportunities for our children to be involved and innovative. Seeing new businesses flourish, as well as longtime businesses sharing their legacies from generation to generation. I am just as excited to see how we continue to grow here at Gordon Hospital to meet the needs of our community. You see, it's really not about being your healthcare partner when you're sick. It's bigger than that. It's about being your partner before you have illness to promote health. So I feel that the addition of this Women's Center is an extension of that partnership, making it easier for us to take care of ourselves. Thank you.
My name is Garrett Nudd. I'm president of the foundation here at Gordon Hospital. And I've got a few words, but before I do that, I want to recognize our foundation board members who are in the room. They're some of the best people that I've ever met. Mike Davis, Shirley Stepp, Mitzi Hutchinson, Will Ostu, Jim Rosenkrantz, Helen Jones, Carrie Stocks, Susan Remillard, and Jonathan Purser. That's not our full board, but those are the folks that are here. And so I'd invite you to give each of them a round of applause because they do a lot for this community. I loved visiting George Owens. I loved the smell of the fresh farm air each time I got out of my car and walked up his steps. I loved the way his eyes sparkled when he greeted me at the door. On a beautiful afternoon this past spring, we shared a warm slice of apple pie together in his kitchen with his niece Deborah, who's standing right over there, and my assistant Wendy Taylor. A couple days later, he called me to tell me something. After he finished, I asked him, "George, is there any of that pie left?" He started laughing, and then he said, "What do you think?" George lived in a lovely but humble farmhouse just across the field from where he was born. He spent his life as a cotton farmer and eventually turned to warehouse development. In 2012, George and his wife Edna gave a substantial gift to Gordon Hospital, which we used to enhance cancer services. 5 years later, this year, George made Gordon Hospital the recipient of a charitable trust valued at approximately $2.5 million. $2.5 million will go a long way in Gordon County. We are so thankful for his commitment to the community. A gracious and unassuming man, George's wish was that Gordon Hospital use the funds toward the construction of a center that would provide mammograms and women's imaging services to the community. The center will be named after his wife of nearly 70 years, Edna, who passed away in January of 2015. George passed away this past June here at Gordon Hospital. He was 95 years old. And as some of the folks in the room know, he left a significant amount of money to other charities as well. His goal was to enrich people's lives in his local community. I heard that when the doctor told George he only had a few hours left, he smiled and said thanks. And then he turned to the visitor in his room and said, "You were getting ready to tell me about that mission trip you went on. Go ahead and finish." That's the type of person George was. I'm grateful for the opportunity that I had to spend time with George. I loved listening to his stories. I loved his contagious laugh. But even more, I loved that he showed me how to truly leave the world a better place. George loved to brag about his community. He was proud of Calhoun. He was proud of Gordon County. And you know what else? George realized the value of supporting Gordon Hospital. He realized that a gift to the hospital is a gift to our community. He realized that investment in improved health care is an investment in families, children, marriages, wellness, and community wholeness. Community wholeness. I like that. My mission is to make George Owens' vision a reality for my wife, for my 3 daughters, and for you and your families as well. I'd invite you to partner with us and make a huge difference in this community. Brandon mentioned the renderings. You can see those. You'll be hearing more about those in the future. But under the renderings is a brochure about the Edna Owens Women's Center. I'd love for you to take one of those with you as you leave. Don't leave yet. But thank you for being here this morning and for giving us the opportunity to share with you.